Hey, health warriors! What if your muscles worked fine but just for a moment and then gave up? Today we're uncovering the mystery behind myasthenia gravis, a rare but fascinating autoimmune neuromuscular disorder that causes weakness and rapid fatigue of the voluntary muscles. Myasthenia gravis, or MG, occurs when the body's immune system produces antibodies that block or destroy acetylcholine receptors at the neuromuscular junction. Result? The nerve signal can't effectively trigger the muscle to contract, leading to muscle weakness that worsens with activity and improves with rest. MG affects both men and women, often appearing in women under 40 and men over 60. Hallmark symptoms include ptosis, drooping eyelid, often one-sided, diplopia, double vision, muscle weakness that worsens with use and improves with rest, difficulty speaking, chewing, or swallowing, weak neck, arms, or legs, especially later in the day. In severe cases, respiratory muscle weakness leading to a myasthenic crisis. The key to MG? Fluctuation. It's not just weakness, it's fatigable weakness. Diagnostic tests include the Tensilon test, where an injection of edrophonium briefly improves muscle strength, though it's rarely used today due to side effects. Blood tests check for anti-acetylcholine receptor antibodies or MuSK antibodies. Electromyography, or EMG, measures the electrical response of muscles to nerve stimulation. And CT or MRI scans help rule out thymoma, a tumor on the thymus, which is common in MG patients. There are several treatment options available for managing myasthenia gravis. Acetylcholinesterase inhibitors, such as pyridostigmine, help boost the availability of acetylcholine. Corticosteroids are used to reduce immune activity. Immunosuppressants like azathioprine and mycophenolate can also be effective. For severe flares or myasthenic crises, treatments like IVIG or plasmapheresis are considered. In cases where a thymoma is present, a thymectomy, which is the surgical removal of the thymus, might be recommended. A myasthenic crisis is a life-threatening condition where the respiratory muscles fail, requiring intubation and intensive care. Triggers for a myasthenic crisis can include infections, surgery, certain medications like aminoglycosides and beta blockers, and even pregnancy or stress. Nursing care for patients with myasthenia gravis involves several important considerations. It's crucial to monitor respiratory function, including vital capacity and arterial blood gases. Medications must be administered on time, as delays can trigger worsening symptoms. Encouraging rest periods between activities is essential, as is educating patients to avoid known triggers and understand the early signs of a crisis. Myasthenia gravis might be uncommon, but with the right diagnosis and treatment, it's manageable. The key is recognizing the pattern of fatigable weakness and responding early. Have you ever seen or cared for someone with MG? Drop your experience below. It's a powerful way to spread awareness. Like, subscribe, and follow for more deep dives into complex conditions made clear. And remember, recognize the weakness, restore the strength, respect the mystery.